Hi, my name's Sue Kelly. I'm just going to run through how I conduct a neck examination here at Physiotherapy. When you come and have, if you have neck pain or headaches, we conduct first a subjective examination where we talk to you about your area of pain, the depth of pain, the quality of pain, where it refers to, if you've got any pins and needles or numbness or whether you're falling over. We ask about the frequency of your headaches and how long they last and their severity, and whether there's a link between your neck pain and your headache. Physiotherapy has been found to be efficacious in the treatment of neck pain and headaches, both in acute and chronic neck pain patients. We try and take an approach that's based on scientific evidence here at Physiotherapy. We'll also ask you about what makes your pain worse, what makes it better, how you go through the day from morning to night, and we'll also ask you about whether you get night pain. We'll talk to you about pillows and what general activities you do. If you work at a computer, we'll look at how you sit and how you function at your desk. So there's some of the things we talk about. We'll also ask some general questions on general health, your medications, and any investigations that you've had. So if you've had any investigations, bring them with you. I'm going to move on now to what we call our physical examination. So when normally I'd ask you to pop your top off, but if you don't want to, you don't have to. Just face me. So today I'm looking at Leah, and I would look at her general posture. We look for overactivity, wasting, whether there's some asymmetry in posture. Some people have shoulder blades that drop down, and that's something that we need to address, because that can put a lot of load on your neck. We look at the muscles from the front, and then we come and look from behind. We look at the shape of your spine, and then we try and correct your posture there and then. So we'll give you some advice straight away on your posture. So Leah's sort of leaning forward, we'll get her to centre her shoulder. And one of the big problems is a lot of people poke their chin out. Leah's not too bad, but just advice on keeping your chin in. Then, as part of the assessment, we look at what we call active movements. So we look at flexion. Are you okay? And extension, so looking up. Very good, are you okay? And then we'll get you come back to neutral, and then turn left. And we sometimes have a little feel. You all right? And then the other way. You're okay. And then lateral flexion. And then the other side, asking if there's any issues and noting down whether there are any problems. We then go and look at some combined movements. So we get you to look down and you rotate. And so this specifically looks at the action between C1 and C2. So there's 7 vertebrae in your neck, and part of our job is to work out whether you have a joint problem, a muscle problem, or a neural problem. So we'll try and work that out for you straight away. So then we clear adjacent joints, so we just get Leah to show me her shoulder movement and some thoracic movement. So just do some thoracic just to check how we're moving there. Then I'm going to ask Leah to lie down. If you had any pins and needles or numbness, we go ahead and do a neurological, and that includes us testing sensation, power and reflexes. So we only do that if you've got referred pain. I'm going to go ahead and palpate Leah's neck from the front. We call these anterior palpations, and they're commonly taught by physio and used as an assessment and treatment technique by physiotherapists. So we have a palpate of the neck, and we get your permission to do this. So we'd like to, is it okay if I have a feel of your neck? And so we feel each vertebrae. So we come in and feel, and we glide, just a little saw there, glide each vertebrae up and down. And during this assessment, we'll take note of your symptoms and take note of the quality of movement from the glide that I'm doing with my thumb and fingers. If there's anything you're not happy with, just tell me when you're doing, if you come and see us. And then we compare it to the other side. I'm going to roll Leah over now. And so if you just roll for me. And we feel the neck, I'll take your glasses, from the back as well. And obviously I'd have your shirt off at this point, but we won't do in the interest of today. So then I come through and I feel posteriorly, so that's C2, C3, so she's a little sore. Is that hurting? You're right?
Yeah, a little bit.
So we're not, it's designed as part of an assessment to try and verify the symptomatic level so that we can target it appropriately. So we feel centrally and then what we call unilaterally. So I'm just palpating, if you want to come over and have a zoom in there, Jean, of what I'm doing. So this is based on the Maitland approach, and it's taught at the University of Queensland, so it's commonly used by physios. So we'd address, if I was going to treat Leah and she had neck pain, I would find the most symptomatic level and then conduct some mobilisations if that was appropriate. And then I would reassess to see if I'd changed her symptoms. Another part of the treatment that we do is we often retrain the postural muscles around the trunk. So just pop your arms over the side for me, Leah. So this is retraining lower traps. A little bit hard to see through this shirt, but it's just a matter of just posturally turning on these muscles here, okay? And they help maintain good posture, particularly at workstations, and relax. Just roll onto your back again for me, Leah. And you're going to come down the bed away from the hole. So come right down. Another commonly used exercise and assessment that we use is to assess the actual action of your deep neck muscles. So Leah, I just want you to gently take your chin down to your throat. Good. And so Leah's correctly doing that exercise and relax. And this is another exercise that's been found to help headaches from the neck and to help neck pain generally. So this is what we call a core exercise for the neck. Have a sit up for me, Leah. And we address, most importantly, we try and look at the big picture, other influences that might be affecting your pain. So we need to be specific to you as an individual and for you and your workplace, okay? So that's generally what a neck assessment will involve. It takes about half an hour, and we'll send you home with some treatment, some things that you can do yourself, and some postural advice.